Hey, so it's about time for a thyroid update with Andrea. I know that things haven't been really communicated well, but that's been because of so many factors. She's dealt with changing insurance, then issues with doctors. So, long story short, she's ended up on her husband's insurance, had some issues getting into doctors, like she was waitlisted until things were kind of good with that. And I might not remember everything, but another thing, when she finally could get in with a doctor in Texas, her doctor in Utah, even though they agreed on prices because she was doing cash payments because her insurance didn't work here, they then all of a sudden slapped her with a bill and they were like, we won't release your medical records until you pay this. And it was kind of like, what the heck? I already paid for all this stuff. So that was another thing. So anyway, she's now working with some doctors. I believe she's at UT Southwestern. Hopefully I'm not wrong on that, but she's redone biopsies because it's been since last summer. July was last time, or March or July of last year. She did a couple of biopsies. She did them again because deep in her heart she was hoping that diagnosis was a little different, because they go in and inject needles into your thyroid and suck out stuff. And they test it to see what are the chances of it being cancerous. And with her 2 tests last year, there was an increasing chance, they couldn't tell with 100% positivity. But there's also different types of cancers where the cells can look weird, and so it's hard to pinpoint it. So after the second biopsy last year, they're like, yeah, it's looking like it's thyroid cancer. Anyway, so she went back in, they redid biopsies to see where things were at. And again, I don't remember all the numbers and names, but it increased enough where they were like, this is concerning. And what they were saying, again, lots of medical terms, was that basically she needs to do the surgery ASAP. Now she's in, I think she's in her 3rd trimester. She's due May 14th, having a baby girl. And if she were in her 1st trimester, they would do the surgery because they feel what they're seeing is that critical. And normally, if you've ever dealt with pregnancies or seen someone go through a pregnancy, they don't do anything like dentist appointments. They're like, nope, sorry, come in after you've had the baby. But it's that dire. They want her to come in as soon as she has the baby. So she's due around May 14th. So they're scheduling her for June 14th is when she will go in. She's planning to do that. I think they want her to do radiation afterwards, but when you do radiation, I think you have to spend about a month in solitary. She's like, I don't want to do that with a baby. So she's just going to kind of play things by ear, see what the biopsies come back after they go in and take out her thyroid. I'm trying to remember something else, but I guess in case you don't know much about thyroid cancer, it's a survivable cancer. When it's contained to your thyroid and you don't let it spread, or it doesn't spread, you are able to live you can live a life. It's a little bit challenging because you don't have that thyroid. You have to do lots of different medications to regulate it, and life isn't always as great as it was before. Although her thyroid, her doctor told her a year ago, it's at 15% functionality, so it's not like it's that great anyways, so maybe she'll feel better getting it out. We just have to make sure that it hasn't spread to lymph nodes or anything, because that's when it becomes a dangerous, deadly cancer. And so we're hoping that by getting it out in June, things will be good. But Andrea initially she didn't know we were doing the GoFundMe. And she was like, man, why did you do this? In her mind, she was like, I don't want to have cancer. But I think now she's seeing that she's grateful to have the love and support, especially with their home that they moved into. They've had so many issues and repairs that they've run into. And with the cost of a baby and just everything, the baby wasn't necessarily in their plans yet, but the baby, I guess, is meant to be with them. So I do know that they appreciate the love and support. And thanks for being patient as we try to get updates, because it has been a very slow process getting to this point, but we're finally getting somewhere, and she's going to get the treatment she needs.